Good afternoon. I'm Terry Scoggin, the CEO of Titus Regional Medical Center in Mount Pleasant, Texas. And today's Thursday, March 11th, 2021. And thank you for joining us for our weekly TRMC community update. In Northeast Texas, one of the leading, one of the ratios that we have that's just not one of the best ones is motor vehicle accidents, four-wheeler accidents, and accidental gunshot wounds. Those are the types of things that when we look at from a community health standpoint and things we can do to make a difference this year that we'll be focusing on. And I appreciate our trauma teams and our surgeons and our emergency room department who works closely with the administration and physicians at Titus to put on different programs throughout the year. This weekend was a great example. Dr. Beauvais, general surgeon here at Titus Regional, worked with Cynthia Gaddy, our chief quality officer at Titus Regional Medical Center, along with our EMS team, Wade and his team in EMS, to offer a gun safety course. But it wasn't just a normal gun safety course when it comes to dealing with gunshot wounds and health. It was a phenomenal exercise that they went through Saturday. And Dr. Beauvais and the EMS team and Cynthia spent quite a few hours of trying in preparation. They spent days putting these bags together. It was intended to start with competition shooting. And they wanted to put together some bags for these competition shooting events that people go to, that they would have something and how to use it. And some real, there's quality level medical stuff that was discussed in this, how to seal a wound, how to stop the bleed, and those types of things. But it elevated when they started having conversations in the impact in Northeast Texas of gunshot wounds. And I've got nothing but rave reviews for the team, socially distanced, of course. They're all 6 feet apart, that met on Friday on this weekend and spent the day on a gun safety course for what to do for a gunshot wound. So I want to thank Dr. Beauvais and Cynthia and the EMS team for all the work. I read these comments of this training after the fact, and I was blown away about what this training did and how it meant to these people that were a part of it. I look forward. We're going to do these again throughout the year, and we'll advertise it here on Facebook, but I'll attend one of them myself because the things I learned just by watching them put the slideshow together and the different things was amazing. And I know this course is going to save lives in Northeast Texas. From a COVID perspective, the numbers continue to go down. When we look across the region and Region F as hospital COVID patients, as a percentage of hospital patients, you can see we're at 3.52 at the end of the day on Tuesday, March 9th, consistently going down in our area. In the Tyler area to the south of us, they were at 4.46, continuing that decrease. And then the Dallas area to our west at 6.03. You can remember a few weeks ago when we were all above 15% and 20%, and at one point some 25% for the Dallas area. So the decrease in COVID continues, and we're glad to see it. One of the things that we're seeing, though, when you look at just the people hospitalized, you can see the numbers in the Region F, which is a Northeast Texas region. You can see we're staying in that 38 to 37 number. And, it's a little concerning. It's not continuing to drop. It's leveled off, and we've seen that here at the hospital as well. One of the things I just want to call to your attention that concerns us for the future is, the blue line is staffed available beds, and there's beds available. And you can see the number of ICU patients haven't gone up any, but the number of ICU beds available have gone down. And when the state starts pulling back strike nurses and additional support that they've given all the hospitals in Texas, just not Northeast Texas, but you can see the ability to staff those additional ICU beds is going to go down. So what does that mean for us? The concerning thing is, just want to make sure everyone here understands, is we have to be careful and mitigate the spread, because we will not have those resources when we need them in the future. When you look at Tyler to the south of us, the same thing. The ICU beds, they crossed or getting close to crossing available and staffed. You can staying consistent in that area, but the Dallas area as well. Continuing ICU beds are going down, but the staffed available beds aren't going up at that same percent increase. So the beds just aren't going to be available as we start moving out some of the resources that the state provided. So as we go to the numbers and we start talking about what we can do from COVID, some things, one of them is blood supplies. And I would encourage you to give blood. There's quite a few blood drives that'll be happening across the area. Prefert Manufacturing did a blood drive yesterday. Titus is doing one today. One of the things I'd encourage you to do is Carter Blood Care on the internet and just put in 75455 or wherever your house is who's watching this, and they'll give you the blood drives that are within a few miles of your region. You'll see a lot of blood drives in the next few weeks. With COVID and over the last 4 to 5 months, and then the ice storm a few weeks ago, big drop in the available criteria that we have for blood. So I would encourage you to save a life, give blood, look for those things on Carter's blood site. From a vaccine perspective, this is frustrating and it's tough. And there's many people out there who watch this and I talk to at church, at the store, just throughout different events, and text me all the time about the vaccine. And, it's hard right now. We did receive an announcement last week that Titus Regional Medical Center did not get any first doses this week. Last Friday, we gave out 946 doses. And I was truly appreciative of all the staff at Titus who participated in it. We had all hands on deck trying to get those vaccines, first dose and second dose last week, to get them in the arms. And it was a phenomenal day. Well, at the end of the day, early Saturday morning, I got the news we wouldn't get first dose this week. So I was disappointed, and it is getting tough for us when you're not knowing each week where you do. So I would encourage you to go to our website. One of the things Titus is going to do for the time being is we're going to suspend our wait list of adding new members. This group has been diligent about putting your name on the wait list, and we've had over 9,000 people put their name on the wait list, and we use that wait list when we get first doses to get people out there and get them in here as quick as possible. And when we've seen extra doses, we've used that wait list and you've responded. So we'll continue to work on that wait list. If your name was on the wait list, there's nothing you need to do. We're going to continue to send some follow-up emails, follow-up text messages. As we get first doses, we will allow and work with that wait list to get them in your arms. The problem is adding more people to the wait list at this time, it may not be the best thing on our behalf because we have no guarantee of getting more doses. The one thing we will do on a weekly basis is we're going to update and put things out there of where the doses are at. If you'll go to our website in the COVID-19 update and click on it, there'll be a link to the state's allocation, and you'll see where the first doses are coming. I will encourage you, every Saturday morning is the best place to look. On Saturday morning, you're going to know where the doses are going to show up on Monday and Tuesday. And last week, Titus County had three places that received the J&J 1 dose. So getting on those wait lists and calling those facilities, I would encourage you to do. Right now, the state's focusing on 65 and older, high risk, and teachers. And I would encourage you every Saturday morning to look at where the state's putting those doses. Now, you'll look out there and see allocations available or doses available. I don't get too excited about that one because there is a timing from when the person they received the vaccine, they gave the vaccine. It just hasn't been reported throughout the state that that's been put in someone's arm. So I don't know if saying there's 100 doses here and go there. I would look to see who gets their allocation each week, and first thing Monday morning, try and work with that group. Shipments usually come out on Monday, so I would encourage you to look at those. The one thing we did do, I want to thank the City of Mount Pleasant and Chief McCray. Chief McCray has led us from this disaster through the beginning of last March. I truly appreciate him working with the health departments across the area. He was able to obtain 500 Pfizer first doses for tomorrow for people in this area with 65 and older. So I would encourage you, it's not part of Titus Regional Medical Center. It is part of the city and the Northeast Texas Health Department are putting this together. But if you will text your first name, last name, and date of birth to this number, they will try and get you an appointment for tomorrow. It is Pfizer. It is appointment only. It is the Pfizer one, so I will encourage you. Titus will be giving second doses tomorrow at our health system, and I don't want to confuse that with theirs. So if you've got you or your friends are going to get your second dose, come to Titus tomorrow for that. And then the city and the health department of Northeast Texas will be putting on this 500 doses of Pfizer. I would encourage you to text that number. We're going to put it in our comments here. We're going to put a Facebook post out. Tracy and her team are going to try and get that number out this afternoon so we can line up. There were 500 allocated to Titus County, and we want to help do our part to try and get 500 arms there tomorrow. But it has to be 65 and older, so just be aware of that. It's 65 years and older are the ones who are eligible for those Pfizer vaccines as the state continues. One of the things that's been the hot topic this week, as of yesterday, when people coming in want to take their mask off. I want to make sure everybody understands that Titus Regional Medical Center, all of our facilities are going to require masks. We'll continue to require masks for the foreseeable future. We're going to continue to work with restricted visitation for the foreseeable future and limit the number of people. It is our duty and responsibility to our patients, to their visitors, to our staff, our physicians, and to this community to ensure we mitigate the spread. The things that we've put in place have mitigated the spread. masks do mitigate the spread, and they do protect each other. So from a Titus Regional Medical Center standpoint, we have worked with our medical staff, and we have all come to an agreement that we, like most hospitals across the United States, and especially in Texas, will continue the mask mandate requirements while in the facilities at Titus Regional Medical Center. I'd appreciate your support of this. I'd appreciate just your willingness to wear your mask if you're coming into our facility. We will require it. As we have a few other opportunities this week, I would encourage you, the Adult Diabetes Support Group, next Tuesday, March 16th, Christina Graham and her team will be live on Facebook and YouTube. So I'd encourage you to maybe get dinner a little bit early, sit down, a diabetic-friendly dinner, of course, but sit down and just have a good time watching this. Facebook and YouTube. If you can't watch it live, always go back and watch it at a different time. Again, I'm just going to go back to one slide and just remind you who watch it, and I appreciate it. And you have friends who are 65, or your parents might be 65 and older. But if you are interested in receiving a Pfizer vaccine tomorrow in the Mount Pleasant area, if you will text your first name, last name, and date of birth to this number, the team will try and fill up those 500. Now, I can't guarantee you a spot. I can guarantee you it is appointment only, and the first 500 who can get appointment. So please send it to that text number, and I know the team who's working that text number will diligently try and respond. But this is your opportunity. If you're 65 and older, we have sent to everybody on our wait list to let them know of this opportunity as well. But 65 years and older, the Pfizer vaccine tomorrow. On behalf of everybody here at Titus, I want to thank you for your support of our health system, and thank you for support for everything we're doing on a daily basis. God bless.